Firstly and foremost, I think on behalf of the Department of Health and Social Care, we'd like to apologise to those people that have been affected by this incident. The department is obviously taking this incident very seriously, and we would like to reassure everybody that a thorough investigation has commenced, and this information, with regard to the information that's been mislaid. The information that's been mislaid, as has been said in the press release, is the names and addresses and phone numbers of 33 service users of our home care service, along with the key safe codes for 7 of those service users. In addition to that, 43 telephone numbers for next of kin, and also the data in regard to 11 members of staff.
Well, can we first focus on the home care service? Who are we exactly talking about? Who uses that?
The home care service is one of our frontline services. It's currently providing a service to 159 people right across the island. Obviously, we support some of the most vulnerable people in our society, and the home care service provides support and care to enable those people to stay at home and receive the service in their own home. Fundamental to our operation is that those people we support trust what we do, and so it's very important that we convey to our service users that we're doing everything in our power at this moment in time to ensure that we find out what's gone wrong on this particular occasion.
So you said most likely very vulnerable people in our community. Are we talking young, old? Do we know?
No, we're talking about our older population on the island.
You've also said that you've launched an investigation straight away. What other measures have you put in place to mitigate this as quickly as possible?
Obviously, in the first instance, we've taken this incident very, very seriously, and we've ensured, because on this occasion it's paper records that have gone missing, that any documents that we may or may not have are now secured safely until such time as we can establish what's gone wrong.
They're secured safely now. It does beg the question, why weren't they secured safely before?
Yes, I think that's a very good question. I think what's happened on this particular occasion is the paper records have been kept, whereas ordinarily those records would be on a laptop or on a computer. Because the home care service operates an out-of-hours service, at certain times our home carers are on call, and as such they need access to that database, and sometimes, as we all know, we can't always access those electronic records remotely. So in the event of an emergency, they default to the paper records, which were held alongside the laptop.
So now those paper records have been digitised?
Those paper records were already digitised, and what we've done is ensured that they are safely secured.
Well, you also say they've been mislaid. Now, how can you be sure they have been mislaid and not taken?
We can't be sure at this precise moment in time because we don't exactly know where they are.
And also, this is names, phone numbers and addresses. There's obviously more sensitive information that is still safe. Do you want to reassure anybody about what hasn't been accessed?
Yeah, I'd like to reassure our service users that no information in regard to any medical information or financial information has been released or mislaid at this precise moment.